وسهلا بكل الذين ينضموا للاستماع إلى راديو بلدي أول راديو عربي أمريكي ويعنى بقضايا العرب في المهجر. برامجنا في راديو بلدي كل يوم جمعة من 8 وحتى 9 صباحا مع ليلى الحسيني في بث حي ومباشر وعبر WNZK راديو 690 AM. صباح الخير بلدي، صباح الخير لكل مستمعينا.
Welcome to Radio Baladi, the first Arab, Middle Eastern and American simulcast radio show. Radio Baladi is broadcast every Friday morning on WNZK 690 AM from 8 until 9 Eastern Time on Good Morning Michigan with Layla Al-Husseini. Our call-in number 248-557-3300. And now, stay tuned for the best radio talk show on Arab and American issues with your host, Layla Al-Husseini.
While we've been staying safe at home, scientists have been on a journey. The destination, a COVID-19 vaccine. This journey began decades ago with research into other coronaviruses. Scientists built from there with months of research and development, cooperation with other experts worldwide, and clinical trials on tens of thousands of volunteers of diverse race, age, and health status. They arrived at a safe, effective vaccine, and hundreds of thousands in Michigan have already been vaccinated. But the next step is ours. We need to get the vaccine when we can. Keep wearing masks correctly and taking precautions until we reach our destination, freedom from COVID-19 and getting back to the lives we love. Discover the facts for yourself at michigan.gov/COVID vaccine. A message from the Michigan Department of Health and Human Services.
Good morning, and thank you for being with us. This is Khalil Hachem with the local connections from US Arab Radio and Michigan.com. Michigan.com provides real estate news, business news, mortgage news, and recipes and much more. Please visit us at www.michigan.com today for current news and information. Thank you so much for being with us. We're glad that you're with us. Today is Friday, August 20th. The year is almost gone. I can't believe it. School is almost back, and summer is almost gone. And just kind of really fast. I can't believe this is really going. But it is a great day. It is sunny. And the temperature is in the 80s, and we are happy that you're with us. The number here is 248-557-3300. Give us a call. The rising numbers of COVID-19 cases here in the area, and different hospitals are doing different things to really counter this rise of cases. And with us this morning is Dr. Usamah Mossallam, an emergency medicine physician and Vice President and Medical Director of International Initiatives at Henry Ford Health System. He also heads the COVID-19 vaccine community outreach efforts. Good morning, Dr. Mossallam.
Good morning. Assalamu alaikum.
Alaikum salam. Thank you so much for being with us. We really appreciate your time.
Sure, happy to be here.
Absolutely. So what's the update on COVID-19?
Well, as you stated, the numbers are going up. The Delta variant is the predominant variant across the entire country, and the rates have been going up steadily for the past 3 weeks. And frankly, we're concerned. We're very concerned. If you are following the news across the country, you know, the states in the South, Florida, Alabama, Mississippi, Arkansas, are seeing huge numbers with their hospitals being full and their ICUs being full. In fact, some of the pediatric ICUs no longer have any beds. So it's affecting children and young adults and the unvaccinated. Really, it has become a disease of the unvaccinated.
The unvaccinated. Is that correct?
The unvaccinated, right. Those that have not taken the vaccine are the ones who are in the hospitals. Those are the ones who are in the ICUs, and those are the ones who are unfortunately dying.
Yeah. How different is the Delta from the original virus?
Yeah, the Delta variant is basically a mutation that's made the virus that much more sticky, meaning that it is much easier to get infected from it. It is much easier to pass it on, and it's possibly a little bit worse in the terms of making people sicker. So, with the previous strain, one person who was infected typically would infect 2.5 other people. With the Delta strain, if one person's infected, they will infect 8 other people. So it is that much more infectious.
I see. Now, I heard on the news that some people are vaccinated, got infected, but they have mild cases. Is that what vaccines does? Even if you get infected, is still you experience mild symptoms?
Yeah, the vaccines were never produced or made to keep you from getting infected. That was never their goal. Vaccines were made to keep you from going to the hospital, from getting very sick, and from dying. And they remain very, very effective at doing that. And so, yes, you're exactly right. People who have had the vaccine have caught the virus, but it's a much, much milder illness,
and
or dying.
Okay, I read this morning that the number of children catching the virus is much higher than before. Is that correct?
That is correct. Again, it's back to the Delta variant, which is much more infectious. And so, especially as you see some the schools in the South have opened and started, and so it's directly related to gathering in indoor places and closed places, not masking, not distancing. And so it is not unreasonable. We actually absolutely expect this. And we expect it to happen here. As schools open, we expect the rates to go even higher because, again, you're bringing people into a closed space. If they're not wearing masks and they're not distancing, the likelihood of them infecting each other goes up significantly.
Absolutely. Now, you're with the community outreach efforts. What is it you're doing, guys, at Henry Ford to help with the vaccination?
Yeah, so it's been a privilege to lead the vaccination efforts for Henry Ford Health System. And part of those efforts, what we realized very quickly is that there are pockets of people who are hesitant or are uncomfortable coming to a hospital or a clinic to get vaccines. And we made a very concerted, conscientious effort to go out into the community. And then we actually put together several mobile teams, and we bought and purchased 3 vans that have refrigerators, and we actually go out into the community. So we've been in churches, we've been in mosques, we've been in access, we've been in community centers, we have been at schools, and we continue to do this every day still, and trying to reach people where they are, and try to talk to them, work with them to try to help them understand that, we truly believe in the science, and the vaccine is really the only way out of this pandemic. And that's kind of the work we've done. We've been at over 400 different sites, and have vaccinated well over 50,000 people just doing that work alone in the communities with our outreach efforts.
Absolutely. What would you say for those who are still hesitant to get the vaccine, specifically in our community? I'm really surprised the number. It's a really large number of people.
Unfortunately, there's a lot of misinformation out there. People read things that suggest that the vaccine is going to change their DNA. People read things that suggest that the vaccine may make them infertile or unable to have children or get pregnant. They read things that suggest that the vaccine is going to hurt them or harm them. They read about some of the side effects. And I can tell you the research is very clear. The science is clear. The vaccines are probably the best medication we have ever had, these vaccines specifically, because of the amount of research and data we have on them. And so there is no medication. And these are drugs, right? Vaccines are medications. They're drugs just like everything else. There is no single drug out there, including Tylenol, that doesn't have side effects. And yet the side effect profile is very, very low. And what people are afraid of is this gets, unfortunately, it gets, magnified because people put it on social media and they share misinformation. And what is very clear is that the vaccines work. They absolutely work. They keep you healthy. They keep you from getting extremely sick. And they keep you from spreading disease as fast. We know that those that are vaccinated clear the virus much faster and don't shed, meaning they don't carry the virus in their noses or throats or bodies for long periods of time like the unvaccinated. And thus, keep their communities safer. So if you get vaccinated, not only are you helping yourself, but you really are helping your immediate household and your community. And it's about community. And I'm surprised in the Arab community, right? We're about tribe. We're about protecting the community first and not the individual. And yet we have all of these concerns. So unfortunately, we've become a little bit more about self as opposed to the community, which is in this scenario really sad because it's hurt our community.
Absolutely. And what are your thoughts about the booster shot?
The booster shot is coming. There's been some research that suggests, just like any vaccine, right? So just so people know, when we talk about the flu vaccine, we take it every year because we know our immunity wanes, or the ability to notice or recognize a foreign substance like a virus goes down if you're not exposed. And so that's the whole process, and that's the whole thinking behind the booster. The booster will actually re-expose your body to this antigen or this protein so that your body makes more antibodies, has a revved up response, if you will, so that, God forbid, you are exposed to the virus, you can fight it stronger. We know that people, not everybody responds to medications the same way. And the vaccine, again, I said, is a medication. And a lot of people don't respond to the vaccine in the same way. A lot of people who take medications that keep their immune systems low, and they have to take them because of either bad asthma or because they have cancer or they have rheumatoid illnesses or other illnesses related to their GI tract, where we give them medicines to suppress their immunity. We know for a fact that the vaccine isn't going to be as strong, and those people absolutely need a booster. And that's really right now what is approved at the FDA level, and the CDC recommendation is the boosters currently are only for those people who are immune compromised or we know will not mount a good immune response.
Absolutely. Is there anything I haven't asked you that people need to know?
I think that what people need to know is that we're not out of the woods yet. This pandemic, unfortunately, continues, and we absolutely need everybody to do their part, right? Physicians, hospitals, doctors, medical centers can't do it alone. In this scenario, we need everybody to do the part to help us get out of this. And if we all do the right thing, get vaccinated, we'll be that much better for it, and we'll be back to normal much, much sooner.
Dr. Mossallam, I want to thank you for being with us, and we want to thank you for all the hard work that you do. We're proud of all your efforts in the community, and we want to thank you and thank Henry Ford Health System for all you do. We really appreciate it.
Very many thanks to you and to our community for raising awareness. We have many, many strong advocates in our communities that are pushing for the same thing that I am, again, because it's based in science and it has nothing to do with us. I tell people, as an emergency physician, when people get sick, they come to the emergency department. It keeps me in a job. What I'm trying to do here is keep them from coming to the emergency department. I don't want to see COVID patients in the emergency department because I know it's preventable. So please, everybody, do the right thing. Get vaccinated.
Absolutely. Thanks again. Really appreciate you taking the time to be with us.
Thank you, Mr. Hachem. Everybody have a wonderful day.
You too. Thank you.
Imagine you're on a train track. Somewhere miles away, a train is headed your way. You can't see it yet, but it's coming. Slowly but surely. If you have prediabetes or you're at risk for type 2 diabetes, you may be on the wrong track, and diabetes could be heading your way. Bit by bit, the danger is getting closer and closer. So should you stay on the track you're on now or move to make a change and reduce your risk? If you have prediabetes or you're at risk for type 2 diabetes, you may qualify for the National Diabetes Prevention Program in your local community. This one-year program could be the ongoing support you need to put you on the right track. Not only did participants lose weight, they cut their risk of type 2 diabetes in half. Ready to get on board for a healthier future? Learn more about the National Diabetes Prevention Program and what else you can do to manage and prevent diabetes at michigan.gov/diabetes. A message from the Michigan Department of Health and Human Services.